Good evening to my doctor and all my SGD friends. My name is Vahini M. Shanmugam with my name ending in 224. Today we from SGD B6 will be presenting the SP entitled Vibrio Illness. These are our SGD teammates. For the introduction, Vibrio organisms are gram-negative and halophilic bacteria where their surrounding conditions affect their growth and development. Vibrios are connected with fresh, undercooked, or cross-contaminated seafood consumption or raw clam consumption, which is related to nearly all cases of Vibrio diseases. More than 40,000 reported cases per year and 50 deaths were recorded in United States ever since 2005. However, in Thailand and in Indonesia, 49% of the cases are infected with V. Parahemolyticus, which is mainly found in fish. There are many types of Vibrio bacteria, and some of the Vibrio pathogen can infect humans, such as Vibrio cholerae is the most common inhabitant in the aquatic world. In Indonesia, Jakarta has the most number of people affected by this disease due to insufficient security measures for drinking water resources, improper sanitation, and poor cleanliness. To describe Vibrio illness, their genomes are split between two chromosomes, which has been delivered by horizontal gene transfer and recombination. Gene can be separated into non-halophilic Vibrios, including Vibrio cholerae and other media-capable species without added salt. Majority of them can develop effectively at 30 degrees Celsius at a growth range of pH 6.8 to 10.2 with a max optimum pH of 7.4 to 9.6. Vibrio cholerae is a serious diarrheal disease that can be lethal if left untreated, except for Vibrio vulnificus, which is an opportunistic pathogen that can quickly lead to septicemia.
Hello, my name is Jonas Presbyter Janto with the last three digit numbers R096, and I will explain about subspecies typing. As we know, Vibrio is a genus of Vibrio bacteria that's found in varieties, and most of them found in marine areas. And the exact number of Vibrio subspecies members are not known, but it is estimated there are more than 10 species that have been described, and 12 of them known that can infect human. Some of the known species can be divided into groups. There are cholera and non-cholera groups, and the difference from Vibrio bacteria that infect humans can be seen from the source of infection, the route of infection, such as oral or one exposure, and also from the clinical manifestation that occur. And why is it important to know the difference from the Vibrio bacteria? It's because the difference in bacteria that infect humans will have different therapies to be carried out. And this is some known species which can infect human, such as Vibrio cholera, Vibrio parahemolyticus, Vibrio vulnificus, Vibrio acinonyticus, Vibrio fluvialis, Vibrio holisae, Vibrio mimicus, and Vibrio masticovi.
Good evening, doctor. Please introduce. My name is Michael Christopher. The three digits from the back of my name is 086. So there are several exposure pathways of vibriosis to human. It can be included as foodborne and non-foodborne. And 9% of the cases have got unknown pathway exposure. So the foodborne exposure can be included as food consumption of raw oyster, raw clams, finfish, and crabs. While the non-foodborne pathways can be included into with water animal, food handling, fishing to handling like fishing rod or nets, and people living near the lake or the coast is more vulnerable to be infected by vibriosis. Ear infection while swimming can also increase the risk of vibriosis, and bad quality of water can also increase the risk of infection.
Hello, good evening. My name is Kadewa Putra Datnika. My last three-digit number is 126. So the risk determinant or risk factor of Vibrio illness or infections can be divided into two, depend on the transmission. And the first is foodborne transmission. and foodborne transmission risk factor people can get Vibrio infection when eating raw meat or seafood, eating roadside food, eating vegetable salad, and raw food such as meat or seafood is the most common cause of Vibrio infection. And then the risk factor, the next risk factor is from environment. The risk factor is a contact with contaminated water and natural disaster, and then one association infection. And some condition can increase the risk of getting infected Vibrio illness and getting severe disease, like people who have liver disease, thalassemia, diabetes, HIV, or cancer, and then getting medication that suppress the immune system or reduce stomach acid can increase risk of getting an infection.
Okay, good evening. My name is Gideandra Adisya with last name number of 196. And I'm going to talk about the association between the bacteria itself with the foodborne illness. Okay, first of all, I'm going to talk about particularly about the Vibrio vulnificus, which the foodborne disease happens when you eat fish tainted with the microscopic organisms, or you have an open injury that is presented to them. The microbes are every now and again found in clams and other shellfish in warm waterfront waters throughout the late spring months. Individuals who have fever-resistant frameworks, particularly those with long-haul or constant liver illness, are at more serious danger for these conditions than others. And also lastly, Vibrio microscopic organisms normally live in seaside waters and can focus inside shellfish and other fish that live in these waters.
So my name is Windiarta. Last 3-digit number is 037. For the prevention, this disease is by avoiding eating raw or undercooked seafood, because seafood is the reservoir of this bacteria, and contaminated seafood cannot be distinguished by smell or taste. So we must do fry, bake, steam, or boil oyster, clams, and mussels for 5 minutes or until it plump, and boil shrimp or crab until the shell turn pink and the meat is cooked. For fish is cooked until the thickest part is opaque. Next, avoid the exposure to seawater in summer, and promptly seek medical attention if you have fever, nausea, abdominal cramps, diarrhea, myalgia, or severe pain in lower extremities, and high hydrostatic pressure or a non-thermal process has been shown to be effective in impacting the Vibrio vulnificus and Vibrio paramolyticus in oyster without change in original nutrient, flavor, or appearances.
Okay, my name is Intan Saraswati and my last number is 215. Now I will explain about the symptoms. Symptoms of Vibrio infection can vary depending on the species. Common symptoms include watery diarrhea, stomach cramping, nausea, vomiting, fever, and chills. Usually, the symptoms occur within 24 hours of ingestion and last about 3 days. Vibrio microorganism can also cause a skin infection when open injury is presented to saline or salt water. Serious disease is uncommon and regularly happens in individuals with weakened immune system, such as have liver disease, cancer, diabetes, thalassemia, HIV, receive immune suppressing therapy, take medicine to decrease stomach acid, and had recent stomach surgery. Next.
Hello, my name is Rati Santi with my last 3 numbers are 206. I'm going to continue the presentation by talking about how to diagnose Vibrio illness. There are 2 types of procedures that we need to do to determine whether the patient is having a Vibrio illness or not. First is clinical diagnosis. There are 3 steps that we need to do. First is to obtain a complete medical history of patient based on Basic 4 and Secret 7. And the most important is to find out if the patient have a history of direct or indirect contact with marine environment, brackish water, fresh water, or their inhabitants, such as fish, oyster, and so on. Second, we need to recognize any species-specific syndromes, such as in Vibrio cholera infection, the patient will have a watery diarrhea as symptoms. It may be easier to recognize this species-specific syndrome in highly endemic area, but it may be difficult for other countries who have rare cases of Vibrio illness. Third, every information that we had gathered need to be confirmed with the help of additional tests, such as laboratory or from the microbiology department. For the laboratory diagnosis, Vibrio illness required a spatial enrichment and plating media to recover or to classify the causal agent from the specimens. Before the laboratory assessment itself, there are a few things that we need to do. First, we need to collect the specimens. It can be done by rectal swab, and then the specimen will be collected in a Clark-Blair tool. Or during an outbreak, the specimens can be collected with gauze or blotting paper, disc, and stored entirely sealed container before transported to the nearest laboratory. Then, the specimen will be enriched with an alkaline peptide water, pH 8.6. The specimen then will be isolated with an agar called the TCBS, or thiosulfate citrate bile salt sucrose agar, which is the standard medium for Vibrio species. Then the isolated colonies will be picked and tested for confirmation, whether using conventional, commercial, or molecular methods.
Good evening. My name is Merisa Afifah Nurmalia Anwar, and my last three digit of student number is 15195. And now I will explain about the treatment of Vibrio illnesses. So, usually infection caused by Vibrio is self-limiting. Treatment is not necessary for marked cases. Patients should maintain their fluid intake to replace fluid losses caused by diarrhea. Oral replacement therapy must be started immediately after the patient can drink. We can determine the requirement of fluid replacement by determining the level of hypovolemia. Intravenous fluid therapy may be needed if patient cannot tolerate oral replacement therapy. Also, antibiotics are mainly used for more severe cases. Antibiotics mainly used to treat Vibrio cholera infections, including tetracyclines, macrolides, and fluoroquinolones. Single oral dose of ciprofloxacin 1 gram or doxycycline 300 mg may be used to treat non-cholera Vibrio enteric infections. Wound infection caused by Vibrio may be treated with oral doxycycline 100 mg every 12 hours. Wound infection may also need debridement. For patients with necrotizing fasciitis, early fasciotomy less than 24 hours after manifestation of clinical symptoms may be life-saving. And next.
Good evening. My name is Nadia Rachel with the last three digits 233. I'll be talking about antimicrobial resistance in Vibrio species. The agar dilution, broth dilution, and Kirby biodisk diffusion are used to assess antimicrobial resistance in bacteria. This is done by infecting bacterial cells at different concentrations of the antimicrobial fabric to obtain minimal inhibitory concentration. Amoxicillin, ampicillin, carbonicillin, ceftazolin, ceftazolin, colistin, gentamicin, and tropomycin are reported showing signs of resistance in majority Vibrio parahemolyticus. Cholera has risen as infamous multi-drug resistant and centric pathogen that causes acute watery diarrhea. Chromosomal mutations are the main cause to antimicrobial resistance.
I'm Merisa, and now I will explain about the prognosis of Vibrio illnesses. Case fatality rate for Vibrio cholera infection in most affected countries is less than 5%, while during outbreak, the case fatality rate can reach up to 50% in another country. Patients with mild cases of fibriosis recover for about 3 days, but more severe cases may lead to severe illnesses and may need intensive care. Limb amputation may also be performed in patients with severe Vibrio vulnificus infection, thus indicating that severe Vibrio vulnificus infection are having poor prognosis more than in other cases. For patients with Vibrio cholera infection,
This can be life-threatening if severe volume depletion occurs, leading to hypovolemic shock and metabolic acidosis. Next.
Good evening. My name is Okiani Setiawan, and my NIM number is 165. And now I'm going to continue for the conclusion. So Vibrio is a gram-negative, rod-shaped bacteria that is a natural constituent of freshwater and marine environments. They are divided into cholera and non-cholera infection based on the species. And the subspecies that cause cholera is called Vibrio cholerae, while for the non-cholera subspecies consists of Vibrio parahemolyticus, Vibrio alginolyticus, and Vibrio fulnificus, and other. Fibriosis can be acquired by several pathways, such as foodborne acquired, non-foodborne, and the list is from unknown origin. For the non-foodborne transmission is by having contact with contaminated water. For the foodborne transmission, the risks are caused by eating raw meat or raw seafood. And there is this disease called Vibrio fulnificus foodborne disease that occurs when consuming seafood that is tainted with the organisms that are found in oyster, other shellfish, and sometimes in fish. The prevention of fibriosis is done by avoid eating raw or undercooked seafood, avoid exposure in seawater in the summer, and seek medical attention when having several symptoms. And those symptoms of fibriosis vary depending on the species, but the common symptoms are watery diarrhea, abdominal cramps, nausea, vomiting, fever, and chills. Diagnosis for fibriosis include in clinical and laboratory diagnosis. For the clinical, there are 3 steps to help the diagnosis of fibriosis, whereas for the laboratory diagnosis, the specimen will be isolated and then cultured to confirm the diagnosis. Fibriosis is usually self-limited and treatment is usually not necessary for mild cases, but for severe cases, antibiotics are mainly used and different antibiotics are used to treat different species of Vibrio. In aquaculture, Vibrio included, antibiotics are commonly used in results with an increase of antibiotic resistance. And for the prognosis of fibriosis, it is usually good as patients with mild cases recovered in 3 days, but for more severe cases, patients may need intensive care. Okay, so that's all of our presentation from B6 about Vibrio illness. Thank you for your attention.